Good morning.
Hi, my name is Iris, and I'll be prepping you for your procedure today. How you doing today?
I'm good.
All right, let me wash my hands. And I want to ask you a few questions. Can I see your armband? Can you tell me your name and date of birth?
Robinson, last name, first name Larry,
All right, and what's your date of birth?
2559.
All right, All right, Mr. Robinson, what are you getting done today?
I'm getting a cabbage.
All right, so I'm going to be removing the hair on the area that they're going to proceed on you today, okay?
That's fine.
All right, so that means I'll be removing hair from all the way up to where your chin is, going all the way down to your inner ankle.
That's cool.
Okay, all right, so we're going to start with your chest first.
Right.
Are you able for me to lay you back? Can you tolerate that?
That's fine.
Okay, let me go ahead and lay you back. All right, I'm going to remove the top of your gown, okay?
That's great.
You never want to reach over the patient, only because you don't want to make them feel like that they're suffocating. So you want to walk around and always make them feel safe. All right. So I have this chest exposed because I will be starting with the chest first to remove the hair. We want to stay within the nipple line, starting at the chin, going all the way down to the abdomen, and staying within the nipple line. So what I have today is my clipper vac. I'll be using that today, along with my hose. I also have a clipper box where I have all of my supplies. What it includes is my clipper. I have blade, different type of blades, which this is a general blade. This is a groin blade. And this is a neuro blade. I also have other tools in here in case I need to remove the hair even more. Like I'll have Q-tips that I can get within the belly button. I also have 2x2s just in case the patient has a small little nick and I can apply pressure to that area. So right now I'm going to assemble my clipper along to my hose. What you want to do is take a general blade. You can keep it in the package, and the blade is always going to point up. So you just want to connect them, and it slides in. Okay? After you connect your blade, you want to connect your clipper vac hose to your blade. So what you want to do is make sure all of your parts are secure. You don't have to tie it, you just have to push it in. And this just clamps on top, okay? Your battery sits in the front, and it has a little hook right here, and you can pull to make sure your battery is okay. How you put your battery back in? It is this, the grooves, and you connect it back inside. So you lift and snap. Make sure, okay? To make this a little easier, you can sit the vac inside of the patient's legs so it will not fall on the ground, okay? So how you take your clipper, you make sure your 2 grooves sit inside the groove right here of the clipper, and it just snaps, okay? What you want to do is you have to make sure both of them are on, and your on and off button is on the bottom of the clipper vac, okay? So you can lay between the patient's legs, and then you want to make sure that your clipper is on, okay? And the button is right here. When you're clipping your patient, you want to make sure that the flat surface of the blade is laying flat on the patient's skin. Okay, you never want to tilt because that's what causes abrasions. You want to make sure that it's flat. If the patient is a little fluffy or if the skin is soft, you can pull gently on the patient's skin and you can clip. Okay, if the patient's skin is wet, you will take a dry washcloth or dry paper towel, simply wipe the patient's skin so the blade will not skip against the patient's skin. All right, so you just want to go at a smooth rate, and you can go straight up. All right, try not to scrape or anything like that. That's what causes abrasions. If a patient is hairy and you cannot see any hair bumps, moles, any kind of bumps or anything like that, you want to do 2 layers of clipping. So you want to do a top layer, which you're like almost like you're mowing a lawn. want to do a top layer, and then that way you can see the skin properly, and then you can proceed with going on the second clipping. Okay, so that will be within the patient's chest. So since I'm doing the cabbage, I will be going to the patient's legs next. I want to save the groins last because I want to use a different clipper for that area. All right, so when you're moving down to the patient's leg area and groin area, you can still keep them covered just to ensure their privacy. So when I'm going further up on his upper thigh, I simply want to roll the gown. And I also have either a sheet or a blanket to help cover that area. It makes it a little easier if you have two people. The person on the other side can ensure the privacy while you're clipping, okay? So when you're clipping, like I said, you just want to take your time and hold that area like you're clipping, okay? And you can clip downward as well. When you're getting a little closer to the groin, have that other person kind of hold because that area may be a little moist, okay? Or you can simply ask your patient, is it okay if they hold that specific area while you get to that? Mr. Robinson, do you mind holding this area? I'm going to guide your hand and hold that area while I get closer to your groin.
Right.
Okay. And I will simply just continue to clip. Okay. After I have clipped his leg, which I have gone from the inner thigh all the way down to the inner ankle. And if your patient is wrapped or anything like that or has socks, you can simply remove the socks a little further down, clip that area. But if the patient is wrapped in like a wound, you can keep that area covered. Okay. So when you're clipping and once you're done. All right. Mm-hmm. So now I'm going to go to the groin area. So I will have Mr. Robinson to move his hand back up to his chest area. Keep him covered right here. I will take one side and I will just do one side at a time. Okay. Like I said, that second person will come in handy because they can hold that side. All right. So when it comes to the groin area, you have to go a little further down when it comes to cardiac. So what you do is you will switch out your blade to the groin blade. Simply removing it. Pop up your other blade. Throw that in the sharps box. And then put your new blade on. Okay? Alright. And you can still connect it back to your vacuum if you need to. And if not, you can simply do both of them. One person can hold and then you can clip. Okay? So when you're going down to the groin, like I said, if your patient is able to move their leg, you should have a good surface. One person be able to pull while you gently pull on the other side. And you can clip that whole area. And you want to go a big area. And you may have to go down a little further. Right here, okay? Alright. And you will do the same exact on the other side. If the patient is moist right here, which they typically will be, like I said, you would take a dry washcloth or a dry paper towel, simply wipe that area, and then you should be able to proceed with clipping. Once you have finished clipping the patient, what you want to do is sit the patient, cover them back up. Mr. Robinson, I'm going to go ahead and sit you back up, okay? Let me know when.
All right.
About right here?
Yes,
okay,
yes,
and what I'm going to get you to do is to remove all my items. Because we're going to clean your area, okay?
Yes, ma'am.
I'm going to get you a new gown. Let me get you to wipe down with those cleansing wipes again, okay? So we can get that extra hair off of you.
Right.
Okay, so I'm going to get you to turn towards me, if you can. I'm not going to have you take on. Get your shoes. Okay? Good?
Yeah.
Okay. And then you can stand up. Very good. And then that's when I would change his gown. He will wipe down. And I would change his linen. Or I would take the top sheet off and he would have the clean linen underneath it. Okay? And then I would ask him to lay back in the bed. And then everything should be done. Also, I'm just going to give you guys a couple of tips. If you have a patient that is extremely hairy, sometimes it's going to take a couple of filters to get through your clipping. Because the filter is only but so big. Can you guys see? So this little area right here can get full pretty quickly. So when it comes to, I'm just going to use cardiac as an example. When it comes to a cardiac, if the chest is very hairy, that's one filter right there. And then the legs and the groins can take up another filter. So just be careful because sometimes it will clog. All right. Also, the same thing can happen to your blade. Your blade can go dull. It will stop. It will simply stop clipping. All right. So if that ever happens to you, just carry extra supplies with. I do want to go over on how to properly clean the clippers and to clean your clipper vac. Okay. When it comes to your clipper, after you finish clipping your patient, you can actually submerge your clipper into water. Okay, you can rinse them off into water. It is a wet, dry clipper, so you can use a little bit of soap and then rinse it off. And rinse it off, you want to wipe it off with an oxycide rag. Okay, it is safe, and then you let it dry for the appropriate time. Okay, and the same thing goes with your clipper vac, but do not submerge this in water. You just want to simply wipe this off. All right, and after you wipe it off, you want to charge your battery. Okay, and remember I showed you how to take your battery out. You want to lift and pull out.
Where do the battery chargers are?
The battery chargers live in the back of PSU in the set of brown cabinets. Okay. All right. And that's pretty much it. I just want to share with you guys that you do have a diagram that you can use for most common procedures that are done every day.
That's all right.
It also talks about what is in your clipper box, which is right here. So if you have any questions or you want to know what goes in my clipping box, it should be on the diagram.
Good.
Okay. All right. For the services, we do clip most services except for GYN and neuro. Pediatrics,
To start over, the only service that we don't do.
The only service that we do not clip are GYN, neuro, and most peds. The cardiac pediatric, we do clip of adolescent age. Okay? All right, so here are some of the diagrams that you can look for to help you guide on your clipping. So we can start with transplant. So if your patient is getting a kidney or a liver, you just want to stay below the nipple line and clip 2 inches to the pelvic bone in both groins. Okay, so I use the male, if the male has hair, and then with female, you pretty much just have to get the groins. Okay, let's talk about ortho for a little bit. With ortho, if your patient is in a fixator or if they are wrapped up, you do not remove that unless the surgeon does. Okay, you leave that alone. If you can clip around that area, that would be good. But if you cannot, then you can put in your notes that the patient does not need to be clipped or cannot be clipped. But if you're able to clip around it, what you want to do is get a little bit of tape and put around that area so hair will not get into the wound. And you can clip around that area using a chuck so the hair can fall, using your vacuum to get that area, and then you will remove that tape and make sure you clean up your area.